Artificial intelligence is transforming the healthcare sector from diagnostics to drug development. But amid the excitement over automation, a vital question remains: what happens to human empathy and emotional intelligence? Joining me now is Brenda Reynolds, here to outline more about this topic. It's good to have you with us. How is AI currently being used across the healthcare sector? What are you and your team witnessing?
Well, it's being used in really effective ways. It's helping us promote drug discovery. It's being used in clinical trials. And so it can really take tasks that can be done faster. It takes things that were mundane tasks or routine tasks and allows us to free up time for things that we really need humans to have time for: creative ideas, suggestions, strategies, and the people element, managing relationships.
Yeah, I think that's such an important part of what makes a good hospital or a good healthcare system operate. But what are some of the human qualities that AI still just can't replicate based on what you and your team see day to day?
It's not going to replicate those moments where a human in real time is seeing something occur in front of them and can use judgment. So it may be that glance that gets exchanged between two people when the doctor is interviewing them about their symptoms. So you know that dad isn't being quite honest about his answer. Or being able to console a child who's crying after getting their vaccine. There are so many things that we really need the human touch with, and we need empathy for, particularly in a vulnerable population in the healthcare segment.
Okay, so can you give us an example of where human insight actually made a key difference to a patient's outcome, or perhaps something more broad in the healthcare sector?
Yes, I mean, there were really studies that were done that were intercepted by human observation, where they were really trying to diagnose an eye condition that people had, and the practice that they were going through was somewhat limiting. And then somebody had some discernment to say, why don't we get in front of these people and look at this from a different perspective? And it was that discernment in that moment that actually led to the discovery of an eye disease that they otherwise would not have prescribed.
Absolutely incredible. So in the same way that AI or technology can actually do the same, we've got this human-centered interaction as well, providing similar things. So it's exciting to think that we could work in tandem, not be replacing one another. But why is active listening so important in patient care? And active listening is one thing I get told off for at home.
All right, that's a whole other segment. We won't go there with your home life right now. But it's especially important, I think, when we feel vulnerable. You know, we feel like there are a lot of decisions being made about us by other people. And oftentimes things are being discussed that we don't understand. Big words, medical terms. We feel like we are really left to someone else to deal with. And we need to have folks who can really listen to not just the words, but our vocal tone, that can hear the fear, who can see that we have a question, who can listen beyond the words. And that's where, you know, humankind comes in, and active listening is especially important. It's also important to make sure that what the person is trying to communicate is what the other individual is hearing, the medical professional, so that the treatment can be right on and what they need can be right on, and the questions they may be wondering about can be answered appropriately.
Brenda, how should we view the relationship between AI and human expertise moving forward, do you think?
As a combo. I mean, really, AI is meant to augment our work, not replace us. It is meant to take complex things and do them faster. It is not meant to replace the human being. I mean, if you think not just in healthcare, but there are so many professions where AI cannot replace somebody, whether it's being a clergy or it's being a tradesman who needs to come over and fix your plumbing. It's really meant to do aspects of perhaps those jobs. It can generate research on scripture, but it's not going to produce the sermon and deliver the sermon at church that morning. And so it's really meant to work in tandem with it, to allow us to quickly take care of data-related and task-related efficiencies, but not to then replace the human, but allow the human to have even more time and ability to do the job that we do best.
Brenda, well outlined by you. I'm curious to know if people want to find out more information about you, the work you get up to, or perhaps some of the books behind you there, where's the best place to go?
Yes, the best place is my website, which is brendareynolds.com, and they'll see plenty about my books. I'm really an expert on change and transition, and I've done a lot of work in the healthcare systems.
Wonderful stuff from you, and I appreciate you taking the time to speak to us today right here on Ticker.
Thank you.